Dr. Nick Araza. Welcome to Traction. So excited to have you here. It's a big milestone. So you should be proud of yourself. So starting with spinal traction devices is a way to lengthen permanently, change permanently the shape and alignment of your spine. And in order to do that, you got to get through the acute phase. You got to get the inflammation down, the range of motion up. So the tissues have to be a little bit healthier to go into traction. So please communicate if you're in traction and you're starting to feel a little worse, because that means we may have started you a little too soon. We're trying to do our best to gauge when you're ready, when your tissues are ready for this. Just communicate. Okay, so that's the great thing about this is that this is it's not knives. It's not undoable. You just start, go conservatively, communicate. It might feel like you're not doing much at first. We want to keep it kind of conservative. But as you get the hang of it, you can increase the time, you can increase the force, and you'll start to know what to expect. Okay, so ultimately, the changing the plasticity or the change of the ligaments, traction affects ligaments, it affects discs, muscles, and tendons, and it reforms them into a better position, which relaxes your spinal cord, allowing the nerve conduction velocity, the speed, and the amplitude of the messages that feed and work with your body. So it's really about healing now and in the future, because when you relax that cord, you're keeping that pipeline flowing at maximum capacity for years. Okay, so this is really a big thing. Be proud of yourself for doing this, and be proud of yourself for getting on this. Now, there are a few things that are important to know while you're doing traction. 6 things actually make up the results from traction. Okay, so one of them is the position. So we're going to ask your help once we get you set up to start to memorize your setup. Okay, you should know it so that if it's a little bit off, you can communicate, hey, this is a little bit off. We're following the prescription that we wrote. The rehab techs followed the prescription that one of the doctors wrote up. We've practiced, we've trained on your setup to do it just right, but we're just going through cards after a certain point. So we're just trying to match the pictures and what's being done onto you. So you're going to know your traction setup. You're going to know what we're trying to accomplish, and we want you to know, okay? Because then you can visualize it, you can kind of obsess about it, and you can make this happen faster. So the setup is number 1. Know what your setup is. Ask if you don't understand why we're doing things. That's totally fine. We want education. The more you get out of this, the more you put into it. Second, time. Okay, so tissues under tension will deform or form. We're using deformation back into a normal, healthy position. So the research is pretty clear on this, is that ultimately your spine has elastic and plastic properties. Think elastic like a rubber band. Let go, it goes right back. Plastic like a spoon, like a metal spoon. You bend it, it doesn't come all the way back. Bend it some more, it doesn't come all the way back. So we want that plastic property of your spine. So in order to do that, you got to dissipate the elastic energy. It's kind of like a curve like this, okay, where you got to get to about 10 minutes before you start to get really a solid, permanent type of an effect to the tissues. And really where it maxes out is about 20 minutes. Okay, so you can keep going and make some small change, but really you get the most bang for your energetic buck at about 15 to 20 minutes. Okay, so in our office, we typically choose going for 15 minutes, but you can't skip all the other minutes before 15 or you'll injure yourself. Traction is a workout for the ligaments of your spine. So just like a workout, you want to build into it. You don't want to start with your max deadlift. You want to build up strength, repetition, know your body, what it can handle. So time, setup and time. Then comes force. Okay, so force, we start slow on time, we start slow on weight, and we'll build that. It's to tolerance. Okay, so you want to be somewhere between a 5 and a 7 in discomfort on the quality, like the comfort scale. If you're under 5, it's usually not pushing hard enough to make a really great change. If you're above 7, you're usually starting to guard because it's so uncomfortable. So 5 to 7 is kind of that sweet spot where you can be relaxed and still tolerate it, not guarded. Okay, and it's still doing things. So we've got time, we've got force. And then how we work it is we'll build you up. We'll start with a little bit of weight or a little bit of tension, and then we'll build up the time, usually to about 15 minutes, and then we'll drop the time to like 8 and build up the weight and build that back up, then drop it, build up the weight, increase it, just keep going, okay? So setup, time, force, consistency. You got to show up and you got to keep working on this, because that metal spoon, it's got a pattern in you that we got to undo. So it's slowly going to go back until we get that more permanent fixture. So we rep it, we rep it, we rep it, and we change it over time, just like building a bicep or a good squat or a snatch or whatever else, learning how to ballet. It just takes repetition to train patterns into your body. Fifth is going to be temperature. The more warm you are, the easier body temperature, the easier traction feels, and the more change you're going to get. Okay, so make sure you do your warm-up. You can do a double warm-up if you want. Getting your adjustment beforehand in the beginning. Once things calm down, you can do double warm-up if you're already well into your case there. But make sure your tissues are warm. If you've got a dental roll, spinal orthotic for home, do a little warm-up before you get on it. You'll get more out of it, and it'll feel easier. Okay, spend a couple of minutes, get that, where you start to feel like, oh man, I got to take off my jacket. You know you're a little warmed up. And lastly is water consumption. A guy who was in here just the other day, we've regenerated his L5 disc he was down to like the posterior, the back aspect, he was probably down to like 10%, and now he's up to like 60, 70%. So you can regenerate a disc, taking pressure off of an individual nerve root, improving the health of your spine as well as the organs around it, but you got to be drinking lots of water. He's been following one of our nutrition guidelines. We have a nutrition video. He's been reducing his weight. He's been really consistent with his care. He's been good on his traction. He's been drinking lots of water, and we're seeing his discs grow. Okay, so you can regenerate a disc. It's really awesome. It's going to, he's going to be around longer on this planet with better quality of life because of it. So spinal orthotics, we'll have individual videos for that. But just welcome to traction. Communicate, ask questions, and really give it a couple of sessions, 2, 3, 4, before you ask to push. Okay, because you want to get the feel for it. But then after weeks 2, 3, just start pushing. Do what you can tolerate. You might be a little sore afterwards, like a workout. It's okay, but it shouldn't be pain. It should be therapeutic. And yeah, congratulations.